Okay, so first thing, I see plenty of shoulder patients, and so the overhead reach, just to keep it simple, not checking every range of motion, but just having them go straight overhead in that kind of a 45-degree angle. And the first question is, how high can they go, for one? What's their range of motion like? Do they get any kind of an impingement or block along the way? Or maybe they have a pain in the middle and then it gets better at the top, which is called a painful arc. If they're dealing with any kind of pain, discomfort, a blocking, pinching feeling, or they can't get above about 150, 160 degrees, in those situations, I would really use caution with a lot of overhead presses or really, really strong, even below, below shoulder level, really, really strong forces, because quite often, especially in your patient population or your client population that's like middle-aged to later in life, when they have that impingement or that pain coming up, there's already some level of fraying or minor tears at the tendon, at the supraspinatus, the rotator cuff tendon. And so if they're repeatedly, even at light forces, pinching on that small tear, or if they do a big force, using that tendon, that small tear can become a big tear. And that's a really long rehab process after that surgery. So you want to definitely be careful with that. This is one of the few things we talk about where I'd say if this is going on, it should be referred out, simply because there's so many things that could be a part of that issue. It's not just necessarily the joint or the soft tissue or the scapular mechanics. There's just so many things that can contribute to that being a problem. That's one I would definitely send out to a good therapist. If it's appropriate and you can see how their shoulder blades move, you can get them to do it backwards and slowly lower down. And as they lower down, see if their scapulas kind of come back into midline fairly symmetrically. What you might see sometimes if there's an issue with the way the scapular muscles are working is that they'll have some scapular winging or kind of pop out or move differently. And if you see that, there's a dysfunction present. And there's a lot, I'm sure you guys know about shoulder stability exercises and scapular mechanics. So if that's all that's going on, they have good range of motion, decent strength, no pain, don't need to send that one out. Just get that scapula moving right. So the next thing is abdominal strength testing.